Resources. AMC Exam Preparation Helpful Resources. Dr. John Murtagh's General Practice books guidance along with some questions. A list of AMC MCQ exam preparation books, which are John Murtagh's General Practice, AMC MCQ Handbook of Multiple Choice Questions, Anthology of Medical Conditions, Good Medical Practice, Guideline for Preventive Activities in General Practice, RACGP, RCH, very important. These guidelines are very important. M plus X, Q Bank are also very important. Now we can see most of the things. First, we give a read of John Murtagh's this general practice book, which is very important, and after that we mention the books. Go through these books as well. Now we can see emergency care here. Some things from emergency care, principles of management. These are important that practitioners must know some things, which you can see at here from your from this book of John Murtagh. It is also written very well. You see from all these things from John Murtagh, and means after it is very important because in this sense it is the same questions will come in AMC part 1 from this book so you must see this book as well. Vital basic skills questions come from these sides, like rapid intravenous access, cardiopulmonary resuscitation including upper airway relief, intubation, ventilation, cricothyroidotomy, arrest of hemorrhage, and most other things. Questions or recalls which I will also show in this video as well, which come from these sites. Alarming symptoms and signs like unconsciousness, convulsion, seizures, chest pain, pallor, sweating, collapse, significant hemorrhages, breathlessness, including bronchial asthma and other bronchitis or bronchiectasis, and some other things like heart attack, and these all are symptoms very well written in this book. Don't forget the value of oxygen. Yeah, it is mentioned at here in this emergency care portion of this book. Ideally, the doctors who attend emergency calls should carry on oxygen delivery unit, or at least rely on the simultaneous arrival of an ambulance with the resuscitation equipment. And yeah, you also see 12 golden rules, like always consider the possibility of hypoglycemia and opioid overdosage in the unconscious patient, intra-abdominal bleeding first, and foremost in a patient with abdominal pain who collapse at toilet. Acute chest pain represent myocardial infarction until proved otherwise. Exclude the meningitis and septicemia in children. Sudden onset of drowsiness and pallor, and consider the possibility of a ruptured intra-abdominal vesicles in any person, especially in child with persistent post-traumatic abdominal pain. Always consider the possibility of acute anaphylaxis in patients with past history of allergies. Always consider the possibility of depression in a postpartum woman represent with undifferentiated illness or problem in coping with the child, with the baby. Yeah, there's anaphylaxis as well. It is a big problem here in Australia, and we can see the patient in the GP clinic and in emergency department, and all this means you can see recalls and questions in AMC part 1 as well. It is very important topic of AMC part 1. Causes of acute anaphylaxis, you see here patients who are children and adults who have allergy from nuts and from different foods like fish and other things, from medicine as well, like some AC inhibitors and other things. We can see here in this book symptoms of anaphylaxis, and these symptoms are means if the patient reached early in the clinic or hospital, these all symptoms are treatable if doctors are alert and know everything. And here for treatment of anaphylaxis, we give oxygen, adrenaline, nebulizers, and means relax the patient in hospital, and give also acylbutamol aerosol inhalation, If very severe, add glucagon as well. Admit to hospital, observe at least 4 hours, discharge on diphenhydramine and give other medicine as well. And for solving the part 1 examination, a hemodynamically stable 40 years man with gastrointestinal bleeding and hemoglobin of 6 gram per deciliter is receiving packed red blood cells transfusion. Soon after the initial initiation of the blood transfusion, the patient become confused and develop urticarial, subsequently unresponsiveness with the systolic blood pressure of 60 millimeter mercury. Which of the following agent is the cause of this patient's condition? Options are lisinopril, amoxicillin, metformin, or propranolol. The correct answer here is ramipril. Sorry, first option is ramipril. First answer is ramipril at here, because the angiotensin converting enzyme inhibitor may be the cause anaphylactic reaction. Now we can see in bronchial asthma. Next slide. Here we can see the asthma condition in which always means there is a condition in which airway become inflamed and narrow, cause narrow airway and the production of sputum, which cause worsening of the condition of a patient, of a child. Here in this book we can see as treatment of asthma as well. And so you must read this book carefully, because most of the question is that child with asthma attack on the way to hospital, he was given 6 puff of salbutamol with the spacer but is still in distress and has wheeze. What is the next management? The correct answer is 12 puff for the salbutamol. Next question, which is also the recall, came in exam, is a 24-year-old man is brought into emergency department complaining of an exacerbation of his asthma. Which of the following is the most appropriate method of assessing the severity of his disease? Correct answer is C, measurement of the peak expiratory flow. And this is also came in exam. The next slide is of myocardial infarction. Heart attack is most common medical emergency and very well written in myocardial in John Murtagh. And this slide shows that it usually occurs when a blood clot blocks the blood flow to heart without blood tissue loses oxygen and become necrosed. And here we also show the symptoms of myocardial infarction: anxiety, crushing chest pain, left arm pain, arm, back, jaw pain, mostly in women, diaphoresis and sweating, etc. Diagnosis of myocardial infarction, very important for an AMC question. And here we show the history and the investigation. Most important, top I, top T, CKMB, and ECG. First line management of MI also written in John Murtagh very well, and questions came from this site as very this is very important, guys. I tell you that you must see all which I am telling you, and must see John Murtagh very well. And it is more very important thing which I will tell you about RACGP or RCH guidelines, which are very important for AMC part 1 point of view. Here we also show the opioid overdosage. It is also very important. After taking overdose of prescribed opioid medicine or after taking illegal drugs like heroin, person faced physical and mental symptoms. It can be life-threatening and require immediate emergency care. In GP clinic as well, we doctors should be alert about this. And for AMC part 1 point of view, it is also very important question. Symptoms which we can see for opioid overdosage are consciousness, like depression, pinpoint people, person becoming depressed, or respiratory system also means we also focus on it. Now the immediate management on it, attend to airway, like for example pocket mask and bag, naloxone. Beware of recurrence of respiratory depression, urogenic pulmonary means attack can be happen. And next slide, which you can see at here, is hypoglycemia, which means low blood glucose level. Symptoms, you know about the hypoglycemia, and the severe cases can lead to convulsions, seizures, delirium, fainting, loss of consciousness, and symptoms of hypoglycemia, which we can see. And the causes, that maybe excess overdosage of insulin, or means taking food after using this insulin. And here we can see the management of the hypoglycemia. We give immediately we give glucagon if the patient is in emergency department, or give oral glucose, or other carbohydrate things like juice, or any other thing like sweets. And yeah, immediate treatment, which we can also see here in John Murtak. I will show the recall on hypoglycemia. A 28-year-old insulin requiring woman is found unconscious in her apartment, reached in hospital emergency by her husband. She was unconscious at home, so she cannot provide any history. Reached in emergency by her husband, and here diagnosed hypoglycemia. Here blood pressure which we take 80/40, and heart rate 140 beats per minute. The glucose level 2.5 milligram per deciliter, potassium and bicarb normal. Which of the following is most appropriate initial treatment? Option A is right. Administer glucagon 1 milliliter IM or IV. Here myocardial infarction. Next slide. And we can also see it in John Murtak. The case of myocardial infarction is that 62-year-old woman is sent to emergency department from her primary physician office with worsening heart failure. The patient has had congestive heart failure, previously controlled with oral digoxin and furosemide. Which of the following is the most likely reason for the exacerbation of congestive heart failure? Option C is correct here, and myocardial infarction. Here we can also see most important topic of yeah, just a minute, guys. A spider bite. Just a minute. Guys, I will show you some more thing. Snake bite. Sorry, first I will show snake bite. Snakes are very common at here in Australia, and snake bite is also as well common. First aid: keep the patient as still as possible. Do not wash, cut, manipulate the wound, apply ice, or use a tourniquet. And all other management you can see here in John Murtak's book. And here they use a scrap bandage over the site of the wound. And sometimes we hear doctors use envenomation. Not all patients become envenomated, and the anti-venom should be used in specific cases. Important early symptoms of the snake bite envenomation include nausea, vomiting, abdominal pain, excessive perspiration, severe headache, dizziness, blurred vision, difficulty in swallowing, like that. And investigation and observation. We should take on care on these things for AMC point of view and in actual practical point of view as well. Treatment of envenomation is also written in John Murtak. First, we reassure the patient at all times. Set up a slow IV infusion of norepinephrine. Keep adrenaline on standby. Dilute dispensing anti-venom, and have adrenaline, antihistamine, oxygen, and steroid on standby. Their spider bites are also very common. Here, yeah. For treatment of envenomation, one more thing, we also focus on monitoring of the patient. Now come on spider bites. All spider bites are also common here in Australia, and the AMC point of view, this is also important topic, and it is also written in John Murtak as well. And we see the treatment of symptoms and treatment of this spider bite as well in this book. Here, the spider bite toxins of the most species of the spider cause only localized symptoms, but the venom of the selected few, namely the red back spider of Australia and the related black widow spider of the US, can cause envenomation. This is rarely fatal but is more serious in the young, the frail, and the elderly. The bite wounds are prone to infection. Treatment of envenomation rarely needed, but it is also written in this book of John Murtak. And here the more other topic is of box jellyfish. Jellyfish is very important and very means this AMC part 1 point of view, and in practical life as well. The two types of jellyfish: box jellyfish and first we see the box jellyfish, which is also called sea wasp jellyfish as well. Here we use prevention: avoid swimming, paddling and waddling in the jellyfish area, and treatment victims should be removed from the water to prevent drowning. Immediately remove the tentacles. Pour vinegar liberally to sting site and surrounding areas. Use up to 2 liters of the vinegar at the time. Use a cold pack for small stings and ice packs by massage for large areas. Check respiration and the pulse. Start immediate cardiopulmonary resuscitation is necessary. Gain IV access and give magnesium sulfate as well. Give box jellyfish antivenom by IV, to the IV view. And the other is the common jellyfish sting. These include blue bottle and others that cause intense local pain up to an hour or more, and linear skin redness. Systemic effects are uncommon. Treatment: wash the sting site with the seawater. Remove any tentacles and glove hand or water. Immerse affected area in the 45. This is the recall. The young boy in northern Queensland got stung by jellyfish and removed the tentacles with seawater. What will you do next? The correct answer is option A: immerse the leg with the vinegar. Here we choose option A because box jellyfish is common in Queensland. In case of box jellyfish, we should immerse the site of the stung in vinegar. Thank you guys. This is my effort for you for the AMC part 1, and this is my first video in front of you. I will show more videos next time, and you also see my videos. Thank you so much. It is very helpful for you. Thank you so much for watching program 1, and please follow all my guidelines and everything, because these are very important for AMC part 1. Thank you so much.